Hello everyone. I'm so excited to be back on a live. Hopefully that a few trickle in, or if you're watching this as an on-demand video. I am going to wait a minute and add our guest of today. So today I'm super excited. We are talking about something very close to my heart actually. It's all about mental health and hormonal imbalance. So bear with me while I introduce and add in our guest, Dr. Rachel Jones. This is where I get nervous, so let's see if I can do this. So bear with me and grab a cup of tea or what. And hopefully she will get the notification. But yes, today we are talking about mental health and hormonal imbalance, and she's here. Fantastic.
Hello. This is when I also get very nervous.
Very nervous. Every time, it never gets easier. I always get so nervous at technical issues and things like that, but I'm so happy you're here. I was just about to introduce you, but I guess it's better for you to do that. But for anyone just joining, today we are talking about mental health and hormonal imbalance with Dr. Rachel Jones. So I'm so excited. I think it's a great time to talk about it actually, because January, I think either ourselves are feeling it or we know someone who might be having Blue January, seasonal low moods. And it would be really interesting to just talk about mental health, but with the spin of hormones, which I know a lot of people have a lot of questions, including me. So I'm fascinated.
Yeah.
But yeah, it would be great if you could introduce yourself and a little bit about your background, just to kick us off and set the tone.
Yeah, so I am a medical doctor. I qualified as a medical doctor, and then after a few years working in acute medicine in the hospital, I decided to specialise in psychiatry, and I've been working in psychiatry for many years in various different specialties within psychiatry. But more recently, over the last, I'd say 5 or 6 years, I've been assessing and treating the general population, so general adult between 18 and 65, and mainly in an outpatient setting, so seeing many patients back to back. And I just started seeing this pattern of women not responding to their psychiatric medication, just not finding the right medication, women presenting to psychiatric services, mental health services for the first time after the birth of a child, and then having chronic mental health symptoms. And this applies to men as well. Men also, as they're getting older, again, just not responding to their psychiatric medication, and then just starting to ask questions that aren't usually covered in a typical standard psychiatric assessment with women about their periods and fluctuation in mental health symptoms throughout their cycle. And a very clear pattern emerged, which led me to be convinced that hormones are hormones, which seems obvious, it sounds obvious, but within the world of psychiatry, it just hasn't yet been acknowledged. And so I started balancing hormones, finely tuning hormone levels in an individualized, bespoke way, and getting a real positive response in my patients. And that led me to set up a standalone hormone clinic where I specifically see women and men who suffer with quite debilitating mental health symptoms in the context of a hormone imbalance. Yeah, so I've been doing that for the last, running the Hormone Clinic for the last 3 years.
Yeah, that's amazing. And it's crazy to know of that massive age range as well. And I think that's a really important thing. And I know we'll go on to it later. But yeah, the age ranges, the different people that might be struggling and might not know it's to do with hormones, because I know for me, I find hormones super confusing. I read the books and yeah, it's really great to talk to you because we can see the names of these hormones and we don't really know where to start.
Yeah.
So I guess today we're kind of going to dive a little bit into that and kind of simplify it and understand what's going on a little bit more. If you could, just give us a bit of an indication or an understanding of hormones and how you might identify or recognize that there might be an imbalance.
Yeah, so hormones, it's quite simple really. All hormones are chemical messengers in the body, and we've got many hormones, but they control every single function in our body. And so it's understandable that if they get slightly out, and they all impact one another. So they don't exist in isolation. So if one becomes imbalanced, that will have a knock-on effect on your other hormones. So in an ideal world, you want to get them all finely tuned and finely balanced. However, that often isn't the case, and it can affect women in particular throughout the life cycle. And the hormones that I'm talking about there primarily are the sex hormones, because as we know, with periods, with menstrual cycles, they fluctuate throughout the month. And some women are very, very sensitive to those hormones changing. So estrogen, I'm mainly talking about estrogen and progesterone, and they really dramatically fluctuate throughout the menstrual cycle. And some women are just very, very sensitive to that. And changes and imbalances in hormones can really impact mental health and very significantly cause quite severe mental health symptoms such as mood swings, low mood, anxiety, irritability, rage, poor concentration. And so it's really important to try and tease apart what's going on throughout the age range, but also throughout the month, the menstrual cycle. And women may get an inkling that either they're very sensitive to hormone changes, which I just mentioned, or there is an imbalance by tracking, if they have any mental health symptoms, tracking those changes throughout the month. And quite quickly, women will often identify a pattern.
Yeah, no, that's really interesting. I know when I've been looking into sort of cycle syncing, and it's kind of when you understand what level you're at and how your mood is changing. So exactly what you said, and I thought it was fascinating because there'll be times in the month where I'm feeling great, I'm feeling creative, and yeah, I'm very sociable, and there'll be times in the month where I don't I don't want to be seen and I'm not feeling creative, and actually I just want to hibernate a little bit more. And I always thought, why was that? And yeah, it makes sense. It is to do with hormonal health.
Yes, yeah, and an element of that is understandable, because we do know that with the menstrual cycle, our hormones are changing and fluctuating between the sort of first and the second half of the cycle. But some women are very, very sensitive to those changes. Either that, or it's not happening as it should do. So the fluctuations and changes are not happening in sync with one another. So what's very important is what estrogen is doing alongside progesterone. So it's about balancing the two hormones with one another. And so if one is doing one thing and the other one isn't balancing that, then that can also cause symptoms. So it's quite complicated, and it's not straightforward, and it's actually quite complicated to get the balance right once you introduce treatment. And so that emphasizes how it really has to be treating the individual. You can't, it cannot be a one-size-fits-all approach. It has to be individualized. It has to be done slowly, carefully, and gradually to achieve the best response.
Yeah, no, definitely. And I think when we talk about hormones, obviously it can, and the imbalance or even tracking it, aside from sort of periods and cycles changing within that, is there anything else that you think can cause these changes in hormones or any imbalances occurring?
Going through the life cycle. So I was talking about periods in women that have regular periods. As obviously they get older and reach towards perimenopause, menopause, and out the other side postmenopause. In perimenopause, hormones are fluctuating, particularly estrogen, quite erratically. Meanwhile, progesterone is progressively dropping, testosterone is progressively declining. And then menopause, your hormones are continuing to drop, and then postmenopause, they're very low. So through the life cycle, as well as through the month, hormones are changing. That's one thing. And it's really important to be able to tease those different periods apart from one another. But the other thing is that the lifestyle that we lead as well most definitely impacts hormones negatively. So stress, for example, is a big one. So we're all living in a very stressful world, working too hard. Diet is another one, is really important. Smoking, alcohol, becoming deficient in various supplements. So all of these are going on in the background as well to add another layer to the mix.
Yeah, no, definitely. And in terms of when we're seeing these hormonal imbalances or feeling more stressed or feeling something's not right, what would be the most common symptoms that you see that maybe would help us realize that something isn't right and it is to do with hormones?
So the big one is the pattern, is the fluctuation in hormones throughout the menstrual cycle. So it's very, very typical for women to describe that they feel at their best in the first half of the cycle when their estrogen is increasing progressively, and then in the second half of the cycle when estrogen is falling, progesterone becomes low. That is the time when often women describe mood swings, low mood, anxiety, irritability, rage, low energy, just not being able to function, as you said, sort of not wanting to socialize, wanting to hide away. Intrusive thinking is another common symptom that women describe in that period leading up to the period. But the good news is that with natural identical hormones, which we now have available to us, so we don't have to use anything synthetic. We can measure and look for those imbalances in the blood and then gradually replenish the hormones that are missing in a very controlled, individualized, careful way to treat the symptoms.
Yeah, no, that's really nice to know there are more natural ways. I know we have sort of our PMS support and mental health formulas, but it's really good because I think sometimes we can get trapped in things, not natural
Yeah.
ways to support ourselves. I know we were talking briefly about hormonal imbalance and how it affects your brain, which I think is so fascinating, and I guess that's probably where it might link to mental health in particular. Could you just explain a little bit about that?
Yeah, so we don't know exactly what's going on in the brain, but when we look at the brain, we see that there are estrogen, progesterone, and testosterone receptors throughout the brain, which tells us that these hormones are not just hormones of reproduction. So we're not just producing them in order to reproduce. They also have a very significant function in the brain, and we also know that because when they become imbalanced, they cause the mental health symptoms that I've described. But we think that what they're doing is that they're impacting the neurotransmitters such as serotonin, dopamine, noradrenaline, and another receptor neurotransmitter called GABA. And we think that what they do is they increase the availability of these neurotransmitters in the synapse. So they make these neurotransmitters more available in the brain. And serotonin, as we know, is the one that's very, very good for mood. It's often called the happy hormone. Dopamine is the one for pleasure and reward. GABA is a really soothing, actually an inhibitory neurotransmitter. It's a very soothing, calming neurotransmitter. So getting all of these in the correct combination at the right level in the brain is paramount for the brain to work properly and do its function. Yeah.
I guess that has a whole impact on every aspect of life. So it is so crucial and key to really get a grasp on that as well.
Yeah.
And we spoke about sort of natural ways to support ourselves and our hormones and our mental health. What options are there for someone that might feel like they might have an imbalance in hormones? Maybe they're dealing with stress, or how can you identify or support someone in realizing what area it is, and how could you help them make a treatment plan and basically help them balance out hormones?
Yeah, so balancing hormones is obviously sort of done from many angles. One is replenishing the hormones that are missing or depleted. So, for example, women going through the perimenopause and menopause and postmenopause, the only way you're going to get those hormones back is by replenishing them. However, alongside that, obviously lifestyle is very, very important because that has a significant impact on hormonal health as well. So stress, for example, is really damaging. It really impacts negatively hormone balances. And so minimizing stress as much as you can, recognizing when you get stress, recognize what's causing the stress, and then try, obviously, sort of adopting stress relieving techniques such as meditation, such as mindfulness, relaxation, breath work, breathing. All of these are really important to minimize stress, which will then have a positive impact on mental health and hormone balance. Diet is really important, so I always recommend following a Mediterranean diet, which is high in good quality fats, olive oil, avocados, nuts, seeds, green leafy vegetables. So all of this sort of low carbohydrate, low sugar, plenty of protein, good quality fats also works alongside positive hormonal health. Alcohol has a negative impact on hormones, so moderating alcohol consumption. Same with smoking, that has a very negative impact. And getting good quality sleep at night is another one. And obviously not carrying excess weight, so keeping your weight down to a good level. And also supplement-wise, a really important one is vitamin D. So I always measure vitamin D in the blood test that I do, because vitamin D is a pro-hormone, and so and most women and men are vitamin D deficient in this country, interestingly, even if they take a supplement. So it's difficult finding the right supplement, one which is, you know, got exactly what it says in it. So vitamin D, optimizing vitamin D to a good level in this country is also really important, because if that is low, that also impacts hormones negatively as well.
Yeah.
Yeah.
That's so, yeah, that's so interesting. So I guess it could be sort of what we have just naturally in terms of our hormone levels, but it also could be the life we're living and external factors that are impacting the levels that we have. So in terms of the work that you do and that you support people, the first step for you would be to taking blood tests and really analysing the levels and then creating a plan from that?
Yeah, so the first step is doing an assessment. So really getting to the bottom of what's going on. So asking a lot of questions about symptoms, when the symptoms are there, whether they fluctuate throughout the cycle, whether they're in the context of getting older, in the perimenopause, menopause. So really understanding the symptoms and having an understanding as well about which hormone, although they all work alongside each other, and as I said, they don't exist in isolation, you can get an understanding about which hormone does what. So progesterone, for example, is fantastic for sleep, it's fantastic for anxiety, irritability, it's great for bloating, it's great for weight, it's great for any breast swelling, tenderness. So testosterone is good for stamina, energy, motivation, mood. Estrogen is good for mood and again, sleep. And so it's about understanding which hormone does what to get an understanding about what may be deficient, and then doing blood tests to make sense of those as well.
Yeah, no, that makes sense, because like, you know, you do like food journals almost sometimes when you have stomach issues, and you start connecting the dots and realizing the themes that go at different times, and yeah, connecting like maybe stress and that certain level. So it makes a lot of sense, and it will give you such a holistic view of not only your hormones but the lifestyle choices you're making. So it's really important. And I guess with hormones as well, I think there are so many misconceptions, and I think especially when, in particular, younger women, but also men and women if they're dealing with mental health issues, but younger women when they're dealing with hormonal changes and puberty, there's a lot of misconceptions and questions that we have. But one is it's not all about, so for the older generation or perimenopause, it's not all about hot flushes, and I know you said women with rage in their 50s. So could you explain a little bit about those misconceptions and your...
Yeah, so it's absolutely not just about that, and it's almost it's about recognizing patterns of symptoms. Firstly, about, as I said, about what hormone may be deficient or need replenishing or rebalancing, but also collections of symptoms to give an understanding about what condition a woman may or a man may be suffering with. So, for example, younger women suffering with PMDD, premenstrual dysphoric disorder, which is a really severe condition and can be very, very debilitating to women's lives. And the symptoms that are very significant with that one are low mood, feeling absolutely hopeless that they're never going to be right again. Women sometimes self-harm in the second half of their cycle where their symptoms are particularly bad, feeling suicidal. So the mental health symptoms can be really quite extreme and need to be taken very seriously. And that's why they were in previous, sort of a few years ago, getting caught up in our psychiatric clinics, because these women were often presenting harming themselves or feeling suicidal, but actually it's about their hormones. It's about an imbalance of their hormones, particularly in the second half of their cycle. And what I want to say to people is that you know, you really can. There really is help out there, and it's relatively simple. And using the natural hormones that we've got, much more preferable than taking sort of, you know, medications and synthetic hormones. So treatment is relatively straightforward, and I get many women saying to me in the clinic, I just wish I'd known about this sort of, you know, years and years ago. Because the good news also is that the improvement can be really quite quick, and also very significant.
Yeah, no, it's so nice to hear, because I think hormones can be quite scary. And I think when you go through certain stages and you're not feeling yourself, I think it can be quite worrying and scary when you don't recognize the moods that you're having or the changes in yourself. It can be a scary place to be. So it's really reassuring to hear you say that, and actually understanding that there might be certain reasons for it and they can be dealt with naturally, and you have support for it. I know we talk about hormones a lot with women, but I know, and younger or people going through menopause, but they're actually imbalances can happen in various age groups, women, puberty, menopause, but also men. Could you sort of talk a little bit about different, for men, maybe the hormone changes they might go through, and how it impacts those different ages that we haven't yet talked about?
Yeah, so the big one, the big hormone for men, is testosterone, and we know that testosterone in men progressively declines between 1 and 2% per year, from about the age of 30. And how quickly that, and it can decline more rapidly than that, and how quickly that declines depends very much on their lifestyle. So as we've said before, stress, diet, weight, sleep, all of these impact very significantly testosterone. And at a certain stage in that sort of life change, men start, and some worse than others, start to get symptoms associated with a drop or low testosterone. And from a mental health perspective, they're very similar to the symptoms that women suffer with. So a progressive low mood, feeling irritable, low energy, no stamina, just feeling like they're not themselves, and sort of intrusive thoughts, talking about brain fog, where they just don't feel, they lose their sort of mental agility, their memory becomes impaired, they can't think straight. And again, this is something that, if recognised and if diagnosed properly through a detailed assessment and blood tests, can be easily treated with natural testosterone.
Yeah. So I think really the biggest takeaway is, if you're not feeling great and you feel like something might be off, just really sitting down and analysing how you're feeling, what your life looks like at the moment, the choices you're making, and speaking to someone and getting some support, and maybe identifying the gaps that you're having or the things that aren't quite working for you, and then you can identify which hormones might be out of a little bit. So I guess beyond sort of those things, you mentioned a little bit about diet, lifestyle, mindfulness, and supplementation. Is there any key takeaways you would give someone that if they're not feeling great today, that they could go off and really start making a change with?
Yeah, so as I mentioned before, stress is a really big one. So looking at what's causing stress in your life, looking at whether you can change the stress, whether you can eliminate the stress, or if you can't eliminate the stress, adopting techniques or strategies to minimize the impact of that stress on you and on your life. And as I said, meditation is very powerful. Mindfulness is very good. Breath work is also very good. So there's plenty out, yoga. So there are things out there that you can do if you're unable to eliminate the stress from your life, because we all have stressful lives and you can't eliminate stress completely. That's one area. Diet, losing weight, obtaining a good BMI, a healthy BMI, and looking at the diet. Looking at your diet and trying to stick as closely to, as I said, I always say Mediterranean diet is the ideal one, with all the sort of good quality fats, and then making sure that you're getting good quality sleep at night. Adopting, I mean, even baby steps, even little steps will make little steps added up make a big difference. So even just making small changes initially. Exercise, of course, is a really big one. Regular exercise, including resistance training, so lifting some weight as well, is also really important. But just adopting these, making little changes, can make a big difference over a long period of time. However, if a woman does have a hormone imbalance, where her hormones aren't balanced properly, they often find it more difficult to lose weight. And they'll say, look, I'm doing whatever I can, and the weight just isn't coming off. And that's where balancing the hormones using natural hormones can often really kickstart everything, because you rebalance the hormones, you find it easier to lose weight. Balancing hormones improves your mood, improves your sleep, and that sort of kickstarts the cycle in the opposite direction. And so often balancing the hormones alongside all of those different strategies is the most effective approach.
So in your opinion, would you say if someone's not feeling great, or they're identifying there might be an imbalance, that they would go and get their bloods tested, and they would also make those lifestyle changes, and not just start with lifestyle changes and see if you would?
So I find somewhere who are obviously experienced in this area, will do a thorough. There's so much out there in the media to read, and as you said, it becomes very, very confusing. And there are many mixed messages out there. So it is about finding a specialist, somebody who has knowledge and expertise in this area, to tease apart symptoms, to do a thorough assessment backed up by blood tests. The other thing about blood tests, it's not, I mean, there are many, many different blood tests out there as well. Some are accurate and some are inaccurate. So it's about finding a clinic where they use validated blood tests, where they know that the results are going to be accurate and consistent, because we also monitor bloods over time as hormones are added in. So it's about finding a specialist and starting from there.
Yeah. No, that's amazing. It seems like a really holistic way of, and it's so important. It's like the foundations, really. I guess it would be great, as you're a psychiatrist and the founder of your clinic, it would be great to know how you do work with your clients and people, so people can see how you support and how they can find help, really.
Yes. So I in order to make the service available and accessible to everyone throughout the UK, because I'm currently the only clinic in the UK as a psychiatrist specialising in hormone imbalance. So the real expertise around the mental health symptoms that I've talked about. But the clinic is online, and so that makes it available to anyone in the UK. So many women and men who are struggling with their mental health often don't want to travel or or go out, and just being able to sit in the comfort of your own home and turn on the computer and have the assessment that way is really effective.
Yeah, and just reassuring to be able to speak about it and know there's not something really, really scary going on. It's just like having a look at what's happening, and balancing yourself out to make sure you're feeling your best. So I think that's really, really great. And is your clinic able to message and
Yeah.
contact it?
Yeah, absolutely. So you can either book an appointment online, or we've got a medical secretary who answers phone calls and will discuss, answer many questions before going ahead with the appointment. And then we stay in communication the whole time. So the treatment process is also mapped out. So women who come and men who come into the clinic start off with an assessment, then blood tests, and then a series of follow-up appointments checking progress, remeasuring bloods at a later stage, really to get the hormones balanced so that they're feeling well. So it is an individualized approach, but it's also very gradual. So the hormones, I always start the hormones very low and gradually titrate, increase the dose according to response in terms of symptoms, because it's very easy to go too high with the hormones, and then having hormones at too high a level cause almost as many symptoms as them being too low. And so if you go too high, you will then forever backtracking, and that makes it very difficult. So it's about starting low, gradually titrating, building up over time until you get a positive response.
And I guess a question from me is, we talk a lot about supplementation, and especially in winter months, and you mentioned vitamin D earlier. With your experience, do you find there's a lot of people that struggle a lot in winter months, and in particular, especially with mental health? And are there hormonal changes within winter months?
Yes, well, yes, exactly. So it's very common for men and women to feel lower in mood in these winter months. A lot about that is about having access to light, sunlight. And so another recommendation I always make is trying to get outside in the morning light, in the morning sun, if you can find some. So will also, it impacts cortisol that we produce as well. So cortisol, if you produce too much cortisol, which cortisol is released when we're stressed, we have a surge in the morning. If that gets too high or imbalanced, that also impacts the hormones that I've been talking about negatively as well. So it's about getting everything in balance, and it's very, very common for men and women to feel low in these winter months. And also optimizing vitamin D is a really important one as well.
Yeah, vitamin D is so important. I've started noticing that, especially in the winter months. I really notice if I forget to take it or anything like that. But no, that is so helpful. And I think you mentioned cortisol there. It's particularly high in the morning, which made me think about sometimes if we have caffeine in the morning and it's spiking that. Is there any small lifestyle changes which are a bit more small that you've noticed? For example, maybe having a different drink in the morning to reduce that spike, that you've offered people that's had some support or some benefit for them?
So caffeine is another one. I mean, obviously, many of us drink caffeine, but keeping it to a minimum is always advised, and also not drinking, having any caffeine really after midday, because if you do, then that's going to impact the quality of your sleep the following night. So yeah, so that's something that I'd recommend as well. So herbal teas, trying to minimize the amount of caffeine that you drink, but also, as I said, just trying to get outside, going for a walk in nature, going for a walk out, getting some of the light is also really important. So there are many changes that you can make, little changes to your lifestyle, and even sort of introduce them gradually and build upon, one upon another, will impact your hormones in a positive way.
Yeah, and tracking it in a journal to really notice that sounds great. I can see a lot of people talking about stress and gut health. I can see talking about vitamin D in the winter months. So there is definitely those correlations that people are having. So it sounds like you just taking a little moment and a lot of self-care actually, and having a look at how, I know you said about the hustle culture and we are a little bit fast and go. and it actually might be putting our hormones a little bit out of balance. So that was so helpful. I guess, is there anything else that you could offer someone support, or would you just say if you are feeling not great, have a look at the lifestyle that you're living, and consider checking your levels, and making small changes to see how you can balance things back out?
Yeah, so journaling is really good, and I always ask women if they're not clear about looking for that pattern throughout their cycle. So that's a really important one. And if women are feeling that their mood drops significantly, that they're experiencing mood swings, irritability, anxiety, even thoughts of not wanting to be here, wanting to harm themselves in that second half of the cycle, what I would like to reassure people is that actually, you know, we have treatment for that, and it's relatively simple, and it's natural, and it's and the response is really quite quick, and it really can change women's lives. So just want to reassure people and say that, you know, there is help out there. And often it can be very isolating when you're feeling low, when you're feeling hopeless, when you're thinking, having intrusive thoughts. It can be really isolating, and you don't want to socialize. But just wanting to reassure that there really is help out there, and treatment that we've got available to us, along with the lifestyle changes that I mentioned, is really effective. And just remember that we're not giving anything extra. We're just replenishing and rebalancing what should be there.
Yeah, no, definitely. And I think the biggest message is you don't have to sit with it. And we talk about it a lot with menopause and debilitating symptoms. There is support out there, and you don't have to just deal with it and feel the impact. There are changes that can be made, and like you said, easy ones that you just need some support putting in place. So thank you so much. I think for me, who's been through some hormonal changes and has struggled, so it's really helpful to hear that. And I know there's a lot of people out there, and some people have said stress and gut health, and I think actually having a look at hormones can impact so many areas of your health, and really benefit you. So that was so helpful, and thank you so much. For anyone listening as well, and anyone who's watching this on demand, everything will be posted, and we'll tag the Hormone Clinic so you can have a look as well, because the work you're doing is amazing.
Thank you.
No, thank you so much for joining.
Lovely to meet you, and thank you for having me.
No, thank you for coming on and teaching us all about hormones. It can be a scary topic to go into. There's a lot. Really helpful, and hopefully that helps anyone going through times of low moods or not feeling great. Check your hormones, check the levels you're at, and analyze what lifestyle you're living to make sure you're feeling your best, and you're living the right life to make you feel good.
And
so
there's always help, and there's always support.
Yes. Perfect. And I will tag all of your socials so people can go have a read as well.
Thank you. Thank you very much.
Thank you so much. Thank you, everyone.
Take care.